Good day. Welcome to the One Voice Pediatric Concussion webinar series. My name is Dr. Peter Rumney from Holland Bloorview Kids Rehab Hospital and our concussion clinic. Today we're going to be talking about what we're doing in the clinic to assess and treat concussion in children and youth. Specifically, we're going to be talking about our complex concussion clinic here at Holland Bloorview and what we hope to be doing now in the next 3 to 5 years with respect to helping children and youth with concussion to get back to their activities of life and doing what they need to do. Who are we? We are a comprehensive team of allied health professionals doing an assessment of individuals after brain injury. We have pediatric neurology as well as general pediatrics, OT, PT, psychology, and social workers involved, as well as our intake coordinator. As you can see, the brain injury rehab program at Holland Bloorview Kids Rehab has had a long history, starting in 1978 through the Hugh McMillan Rehab Center in 1990, the merging of the two different hospitals for acute and chronic care in children's rehab in 95, the expansion of our program through the late 90s and early 2000, and finally we come to the Ministry of Health approval of our complex concussion clinic funding in March of 2014. We were then able to move forward in hiring part-time staff for this clinic and for the first time incorporate the Ontario Neurotrauma Concussion Guidelines published June 2014 as our overarching guidelines for assessment and treatment of our clientele. The clinic officially opened September 2014. As this slide shows, the complex concussion clinic is one of 3 different current activities that are progressing here at Holland Bloorview. 2 research streams, the neurocare and the active rehab research, with some sub-studies going on with sleep and similar evaluations that will be discussed at other times. We also are hoping in the bottom track to develop a return to competitive activity retraining program that will specifically address the needs of those with the highest level of competition. What are we doing to address concussion? Well, since we are only meeting the needs of those with persisting concussion symptomatology, it's impossible for us to provide services to those with acute concussion in the Greater Toronto Area. There would be about 3,500 new concussions a year to address, and this is certainly not within our facility to address. What we have done is to try and meet the needs of the community as much as possible by creating a informal drop-in teaching session, Concussion and You, which has the researchers and occupational therapists teaching about acute concussion, what can be helpful, and how to deal with the symptoms. Within this, we're actually providing them information that they can take back to their family physicians for referral to us if necessary, if they have persisting post-concussive syndrome or symptoms for more than 4 weeks. As you can see, we have developed some information on infographic cards to disseminate some of the basic information and to help debunk some of the myths. We have advocated with some public awareness through media and foundation fundraising events. And the researchers have also been able to do some baseline testing through the local human brain exhibit at the Ontario Science Centre, which also helps us get the word out. What's working well? Well, as you can see, we have this algorithm which really helps streamline the appointment coordination, the availability of clinical staff for short-term assessment and treatment. We have made sure there's training for the physiotherapist to specifically address the issues of neck injury, the issues of balance and coordination and visual tracking. The OT specializes working on some of the cognitive aspects of post-concussive symptomatology and energy conservation. Our neuropsychologist is able to help screen in some of the persisting neurocognitive issues and help decide when it's appropriate to do in-depth assessment and when it's appropriate to use more targeted therapy. We have a social worker who is helping to assess and deal with some of the persisting issues relating to anxiety and post-traumatic stress disorder, and can make referrals back to the community for long-term counseling if that's a need. What's working for us? Well, the information sessions are very helpful, and we have learned very quickly that if families participate in this before they come through the clinic, the next step in their rehabilitation often is far more effective and far easier because they have a common understanding of the issues and the therapy that's needed. We certainly have been teaching our local referral sources about who we can best see and what we can best do. We certainly are very pleased to have the multidisciplinary team addressing the many varied issues and challenges that come forward to us from these families who are dealing with persistent symptoms. We've certainly valued the ONF guidelines for treatment planning and assessment, and have also been successful in collaborating with Dr. Mike Evans to help with further teaching in the community through his whiteboard teaching sessions on YouTube. We have a very consistent team-based formulation and discussion. But what is not working for us? Well, some of the myths that continue in the community. The focus of absolute rest, and that putting some individuals back into bedroom jail. If it doesn't work the first time, do it again and maybe it'll work the second time. Trying to change some of the rigid symptom complexes that have developed over months or years in certain individuals that are very hard to address. And some of the parental impressions that concussion is still ongoing and the brain is still bruised or inflamed months after the last impact. This certainly fosters a disabled role, as does some of the school board policies, which reinforce multiple symptom checklist use for students on a daily and sometimes multiple times a day. Certainly, we have seen that those who have excessive delays and refer to the clinic will just further entrench symptomatology, cause further social isolation, cause problems with depression and frustration. And there's that undertone of fear in much of the media talking about the link between CTE and concussion that has raised the level of the community to a great deal. So what are we hoping to get out of this? Well, a consensus on the best evidence to date, reassuring guidelines for families and their children, a balanced approach to the treatment of initial and uncomplicated concussion, finding what the best indicators are for persistent post-concussive symptomatology and identifying those individuals early, and developing an algorithm that will help stream individuals into the various treatment pathways that will be most effective in dealing with their challenges and their issues. Thank you for this chance to present, and I look forward to our chance to meet and further discuss.